the California Prenatal Screening Program, and Luisa's decision. Now that she is pregnant, Luisa is busy with lots of doctor's visits. California law requires Dr. Park to tell all her pregnant patients that the state provides prenatal screening for some birth defects. Services are covered by Medi-Cal and private health insurance. Prenatal screening through this program identifies the chances of a fetus, a developing baby, having one of a few birth defects. If screening results show an increased chance of a birth defect, California's prenatal screening program will also pay for education, counseling, and diagnostic testing. Screenings offered by the Prenatal Screening Program. The Prenatal Screening Program offers 2 different screenings. Each screening is done simply by collecting a sample of the mother's blood. Each screening checks for different types of birth defects. Prenatal screening checks for extra chromosomes, which cause genetic conditions. Chromosomes are in our cells and hold genetic information. Screening also checks for birth defects that happen during the development of the fetus's nervous system. They are called neural tube defects. Luisa needs to decide if she wants the screenings. Cell-free DNA, cfDNA, screening checks for extra chromosomes and the sex of the fetus. One example of what cell-free DNA screens for is a genetic condition called Down syndrome. It comes from an extra copy of the 21st chromosome. The cell-free DNA screening can also look at chromosomes that predict the sex of the fetus. However, results are not 100% accurate. People decide if they want to know the sex of the fetus or not. The maternal serum alpha-fetoprotein screening checks the chances of the fetus having a neural tube defect. Neural tube defects can cause serious spinal cord problems, like spina bifida. Understanding the screening results. The chromosome or neural tube defect screening results could show an increased chance of a genetic condition or a birth defect. After a positive screen, the state program will offer education, genetic counseling, and diagnostic tests that can better tell if a fetus does have the condition of concern. The screening results could show the chances of a genetic condition or birth defect to be very low, but never 0 chance. Even with low risk, there is a small chance of a birth defect appearing. No screening test is 100% accurate. Luisa's decision. When Luisa decides she does want to get prenatal screening, Dr. Park asks her to sign consent forms to confirm her decision. Luisa feels she has made a good decision for her growing family, but every person and family is different, and that's okay.